One of the quotes that I want to start with, and it deals directly with the chart that I passed to everybody. This is a quote from one of the developers of chiropractic, B.J. Palmer. It's that every organ in our body is connected to the one under our hat. So this means that our nervous system, our brain, our nervous system is controlling absolutely everything in our body. It controls every cell, tissue, organ. So if there's communication disruption between our brain and the rest of our body, or our brain and whatever that part of our nervous system is going to, that area can function 100%. Okay, so what can interrupt this communication? There's three main things. So one of them can be physical things. When we go to a chiropractor, typically we think of pain, right? Like my dad, he fell off a ladder off our roof and he, Beth, I need you right away, right? So physical things, we think bumps, bruises, yes, I'm in pain, I need to go see the chiropractor. So that can actually stay in our tissues. Those forces can affect our bodies in different ways too. So there's physical things, there's chemical things. So this could be food that we're eating, that kind of thing we have control over, and other things that we don't have control over, like the air we're breathing, the water we're drinking, we can't always control exactly what's going into our bodies. So chemically, that can put stress on our nervous system if we're a little overwhelmed. And then the last thing is emotional. This is life. So any stress, any emotional stress, when we might have a certain threshold, but that can be overridden also very quickly and kind of overwhelm our system. So this happens if somebody is driving to work. Well, let's just say their alarm goes off late, so they freak out a little bit, and then the hot water broke, so they take a cold shower, and then they spill their coffee on themselves on the way to work. That kind of you might hit a threshold, and your body might go, that's way too much for me, and I'm going to store that somewhere, and we're going to deal with this later. So these three things, the physical, chemical, and emotional, those can produce subluxations in our bodies. So what subluxation means is that it's just an interruption in our nervous system. It's something that's blocking the communication from our brain through our nervous system out to the rest of our body. Does everybody follow that so far? Okay, all right, that's kind of like the main premise here. Okay, so let's show this. And then you could pass this around too as I explain and kind of play with it a little bit because it gives a good idea. So if we think of this kind of like our body, these longer rods are bones, these balls are joints, and then these strings can be the connective tissues. These are like the muscles, the ligaments, the fascia. So, all right, let's do like a day in the life of my dad again. So he wakes up. So he wakes up, his alarm doesn't go off. So that's like a big emotional thing that he just goes, oh my goodness, I'm late for work now. So our body stores that. Now you see that force, it doesn't just affect one thing. You can see the whole system goes a little bit off. And then, let's see, he spills coffee on himself. First of all, he dumps 15 packets of aspartame, of sweet and low, into his coffee. That's like the chemical thing, right? And then after that, he goes to work, he's a diesel mechanic, and he's underneath a truck, and all of a sudden, like his prop, I don't know the right terms, but whatever he's using to hold something up, drops, and a wheel. Thank you. And a jack. I have a dad that's a mechanic, so I never have to do any of that stuff. So the jack drops, and say like a wheel falls on his toes, and that's awful. So we'll do another stress. Okay, so yes, totally. So okay, so we went from something that was using everything to hold itself together, to hold itself in a pretty good position, to that. Okay, so what does this mean? One, our bodies take on different stresses in different ways, and it affects our whole system. Two, imagine, not only muscles, ligaments, joints, but imagine your stomach sitting right in the middle of that. So when you have all that pressure on your body in a different way, it's affecting our organs too. So, do you guys want to pass this around again too? Yeah, keep going. It's fun. So if we have stress on our organ systems like that, if we have stress on our nervous system, that's how we experience our world. If we have sensory-wise, if our hearing is is off, if our eyes aren't seeing correctly, if we can't touch, like if we're not getting the right tactile information, that's how we experience our world. So if there's stress on our nervous system, we're not getting like the full experience. If there's stress on our nervous system, we might also be overstimulated, which is something that everybody here has probably seen at some point too, with your kids, your loved ones, whoever.
Overstimulation is a big thing in kids with autism, so.
Yeah. All right, so how much irritation then is too much irritation to our spine? We're living life, we have these physical, chemical, emotional things building up over time. So there was somebody that did a study to figure out, well, you know, chiropractors always say it only takes a little bit to affect our nervous system and affect things downstream. So how much is too much? What does it actually take? So they did a study where they took a dime. Now a dime weighs 2.2 grams or 10 millimeters of mercury. You can pass that around too. So they did a study where they put that much pressure on a nerve and then they measured the conduction of it. So basically how fast it was sending messages to the rest of our body. And just the weight of a dime on one of our nerves slowed down that conduction anywhere from 40 to 60%. So when you think about that, if that's a test grade, you know, you're getting 40 to 60% of 100.
Wow.
Yeah, it's a fail. Oh, you got the dime coming to you.
She's like, I need that back.
I know. Guys, I am fresh out of school.
Not take that
So,
That is not a donation.
yeah.
This is my husband owns a trucking company, and we might be able to get your father another job.
Okay. He's hoping to retire on my mom's income soon, so that's all the pressure that it takes to affect us. Now, this could happen, the thing is, this happens without pain. You may not feel any pain at all when it's this much pressure, but it's affecting the function around 50%. So if the messages from your brain are going to your stomach, if they're only getting their 50%, you know, you'll kind of digest your food and your cells will kind of be able to use that nutrition to build your new cells. Yeah, so whenever you're thinking about it, like, well, what is an okay percentage for my nerves to be firing at? Like, am I good with like 70%? That's okay. You know, what is your ideal? What do you want to be functioning at?
Essentially, I would imagine you want that number at 100% all the time.
I would. Yeah.
Without 100%, that introduces disease.
Yeah.
So that's where we wonder why someone drops over of a heart attack when there was a process that happened long before when the heart wasn't given all the signal. And we're not here to say chiropractic is the only answer to all ills, but what we do understand is a piece that the rest of the health world isn't really attuned to, and that there's a process between health and sickness and health and behavioral challenges and health. There's always a process, and we're just here to bring us as close back to 100% as we can, because our bodies were designed to be well on all aspects.
Yeah. So then when you take another look at this chart, you may see it in a new light going, okay, well, if T2, if that's not getting its communication, what does that mean for me long term? Do you need another one?
2.
Okay, so when we see kids with autism in our office, can I have that again? Thank you. So when we see kids with autism in our office, when I talked about this model before, I was kind of talking about the body, you know, what if our stomach is here? When we see kids with autism, Dr. Marie has been in practice. She's been working with kids with autism for over 17 years, so she's been seeing a lot. She's seen a lot of this. So their cranial tension, their entire head is much, much greater than most of the kids that we see, than most of the adults that we see. So when you see...
Physically large or?
No,
more tension.
More tension.
Yeah. No, you're good. They're trained.
Big head,
Well, actually, that's big.
No, you're good. You're good. So what that means, as chiropractors, we're looking at the whole spine, the whole nervous system, but 80% of our nervous system is in our cranium. So if this is under tension all the time, we see kids with autism try and relieve it themselves, either by the stimming, the shaking, Yes, hitting their heads, because there could be so much tension in there, they don't know what to do with it. And that's where, again, I love the technique that we do, because we are working with the cranium, we're helping some of that tension release, and by relieving that tension, you take pressure not only off the brain, but off the entire nervous system. So it's not just one thing or the other, it's the whole thing.
I've noticed, not just with my own son, but with other kids too, that they actually seek out pressure on the head, you know, in the front.
Yeah, and they're holding certain spots that might be holding more pressure.
Yeah, absolutely.
Yeah. Okay, so whenever we see kids after their adjustment, what we see most often is just calmer, like more of a sense of ease most of the time. And there's a couple reasons that this happens. Again, one is because some of that tension is more, just those pockets of tension are more diffuse, they're more relieved, they're spread out a little bit more. It makes it easier for them to handle that. Another thing that happens, so I love the neurologic aspects of chiropractic too. So they did a study for every time after somebody gets adjustment, there's certain chemicals that are released in our bodies, which also contribute to that sense of well-being and to that feeling of, So one of the things that's released after every adjustment is oxytocin. This is like our love hormone, our chemical bonding. Whenever moms have babies, this is the hormone that is released that makes them okay with really late nights with a child. And you could puke on me, you could pee on me, whatever. Like, that's great. I love you. So that's oxytocin, like in full blown motion. And that's just one of them. Okay, so that's just one of the things that's released. Other things that are released, serotonin. That's like our happy neurotransmitter. Yeah. A lot of that in the gut too, the brain and the gut. And neurotensin. So neurotensin is one that maybe you haven't heard of yet. So this is really common in people with schizophrenia that they've studied, that they actually have lower levels of it, and that's what some of the prescription medication targets, is raising those neurotensin levels. So every time we get adjusted, we have neurotensin floating around in our bodies, and we have, you can think of it like a lock and a key. So a lock's on our spine, the key is neurotensin, and it actually gets activated after every adjustment. There's more of it. So, and that is a chemical that literally is made to just make us feel more at ease in the world, more comfortable, more at peace. So that happens to
anxiety.
Yeah, that happens to everybody, not just kids with autism. That's everybody, every adjustment. Yeah. All right, and then I have a little boy right now in practice that I'm working with, and he's 5 years old, and he rocks. And one of the things that he said after his last adjustment, he goes, "Mommy, all my splinters are gone." A splinter for him is like anything, so that's like I scraped myself, it's I have a bruise, it's I fell down, like everything's a splinter, that's any kind of injury. So he goes, "Mommy, all my splinters are gone." She goes, "Oh, did Dr. Beth take away your splinters?" He goes, "Yeah, Dr. Breath took away all my Dr. Breath took away all my splinters." And it's something that, you know, he doesn't always know how to explain, but his splinters are gone, he feels better. And one of the things he said after his very first adjustment was, Dr. Breath fixed my belly. Dr. Breath fixed my head. So not only like, you know, what a cool thing to have happen to you at work for me personally, but yeah, his belly's better. So why would that happen? I have another thing here that we could pass around.
My people used to say I have jumbo brain. I have jumbo brain. God used to say it all the time. My brain's all jumbled. My brain's all jumbled.
Yeah. So one of the things with his belly, there is a brain-gut connection. So our gut, when I talk about gut, I'm talking about our actual like intestines. So our gut actually has its own nervous system as well. It's called the enteric nervous system, and it is connected to our brain. So this is connected via the vagus nerve. The picture that I'm handing around is that nerve. And you can see that it starts at the end of our brain, and then it comes down through our neck, and it attaches to our heart, our lungs, and parts of our digestive system. So whenever we get whenever we get angry, whenever we get anxious, whenever we get sad, whenever we get super happy, sometimes we feel that in our stomach, and it's because those emotions release different chemicals in our body and our nervous system's triggering that. So if we're thinking those emotions, we feel it in our stomach. Likewise, if our gut health is off and if we're feeling, if we're not breaking down our food correctly, if our body can't use our nutrients, if those good bacteria in our gut aren't getting fed and there's some dysregulation in there, that could affect our brain too. So that could actually cause us to feel more anxious, more worried, have a harder time regulating our emotions. So that's a very, very real connection. So the way that chiropractic comes in is that by adjusting the spine and by working with the nervous system, we're helping to stimulate that vagus nerve and just increase the tone of it. What I mean by that, the tone of it, if it's overstimulated, it could help bring it down. If it's understimulated, it could help bring it up. It just kind of helps bring it back to balance. So the vagus nerve is something really big. Other things that stimulate this, when kids are humming, singing, gargling, because that nerve, so much of it is around our neck, so if we do those things, that also stimulates it. So if your kid's humming, let them hum. They're trying to calm themselves down and bring themselves back.
Think about it.
Yeah, so our gut, and that way our gut is kind of our second brain. Okay, and then the last thing for that, the reason why our gut health is so important too, just having our food and our nutrients broken down correctly and actually being able to be used. Our cells are constantly regenerating themselves. So the body that you have today is made up of totally different cells than it was made up of 7 years ago. So every 7 years we have a new body. So if we're not breaking down our food, our body doesn't have good things to make new cells out of. If we're not eating the right food, our body's making new cells and making a new body out of things that, maybe instead of like solid marble, it's making it out of mud pies. Haven't we all made mud pies at some point?
I'm getting a new body, I'm in the process.
You are in the process, you're making new cells right now. So yeah, that's the gut health portion of it. Okay, so that's where like adjustments, whenever the thing that I read about one of our patients with her 2 autistic boys, that's where she mentioned adjustments and the whole food nutrition. So really both of them can work so synergistically together and just produce some behavioral things. You might just notice differences in your kid and your loved one a little quicker by doing both and one or the other, but know that one or the other is awesome. Like doing one or the other is still really, really good.
I have a question, like I have a child who is wicked picky eater, like my goal is terrible, like I've thought about, food clinics and eating clinics and what have you. I don't know that we're ever going to change that piece of him.
Mm-hmm.
So what's your thought on one without the other?
It's still beneficial because I've been seeing it for 17 years. It's just more beneficial with both. So I have kids that still eat total garbage, but their life is so much better because they're getting adjusted.
I mean, literally my son, he's 21 and he eats 6 things.
Right.
One of them is Pop-Tarts.
Well, we've been swapping things out for Michael too. Like now we get the gluten-free chicken sausages so that his hot dogs.
He would eat a piece of meat of his life depending on him.
Well, see, because you eat hot dogs, we swap them out for those.
And finding those
And
easy
that's
spots,
much, it's more beneficial for a meat pack than it is a hot dog. Because that was all he would eat. Macaroni and cheese and hot dogs.
I'm sure she's tried them if she's 21.
The food though now, the supplementing, like to change out is so much nicer than it used to be. I mean, even the pastas are coming in like
If you were in my office, I would say to you, please just give this a chance. Don't worry about the food right now because clearly, like, I see emotion come up with you because you've probably tried for 21 years. So I would say, just give this a chance right now and let's see where we go with this. And maybe this will just be enough to make him happy or make enough changes for you, or maybe there's enough ease in his body, who knows? There might be a possibility of him having a little more flexibility, because that's part of what happens with getting adjustments, is there's an increased flexibility with your nervous system. Maybe, maybe not, but just give the adjustment part a chance and just see. Yeah.
And the way that we evaluate kids when they come in, we look at a couple different things. One of the things that we look at is simply posture. Well, I say simply, but it can tell us a lot. So again, I'm passing around this picture, and I'll explain a little bit more about that too. So one of the things that we're looking at, if we see a kid that their shoulders are very uneven, or their head's kind of tilted, or they're rotated a little bit, or maybe their feet are way splayed out or way splayed in, or their hips are uneven, those are all indicative of some kind of structural postural imbalance. Now sometimes that picture is very exaggerated. It's not always going to look like that, and a chiropractor has more of a trained eye, and you may know that if that's on your radar now, if you're sitting somewhere, you're going to see this everywhere. But that's one of the things that we look at for kids. So one of the reasons that I first started getting adjusted and that I got into chiropractic in the first place was that I went to my grandmother's chiropractic appointment with my mom, and I was 12 or 13 at the time. And the chiropractor looked at me and she goes, "Your shoulders are uneven." And I'm 13, so I don't care. I'm like, okay, whatever, lady. But luckily my mom did not have that attitude, so she saw it, she got it, and she started getting me adjusted there. And one of the things that I started to notice, I always had asthma when I was a kid. My mom would see me running around at soccer, and I was huffing and puffing, and she just thought I was working harder than all the other kids because asthma was not in our family. So she's like, "Good job, honey. Yeah, keep going." Once I started getting adjusted, and well, that thoracic area, my shoulders were crooked, so that was probably something in my mid-back that was off. That's going to my lungs as well. That's going to my lungs, my heart. So once I started getting adjusted, gradually I didn't need my inhaler anymore, and nobody was telling me to go off medication or anything like that, but I could just breathe better. I felt better. I didn't need my allergy shots anymore. I didn't have allergies anymore. So this was over a couple of years, but those were some of the amazing things. That's how I got into chiropractic in the first place. Totally posture-based, crooked shoulders. So that's one of the things that we look at for kids. The other thing that we do is we do different scans in our office. So I'll explain this, but then I'll pass it around so you can have a better look. I'm sorry I didn't print out more of these or blow it up. So this is a scan of a little boy who is 6 years old, and he has ADHD to the point of like hitting kids in his class, he's having a hard time just being in the world. So one of the scans that we do is called a thermal scan. So we're measuring heat differences from the top to the bottom of our spine. Now, the reason that we do this, everywhere in your spine where a nerve is leaving, a blood vessel goes with it. So if there's a subluxation to that area, it could cause irritation to that area, and it'll either show up as warmer or cooler. If something's warmer or cooler, we know something's going on with the nerve in that area too. So on this little boy, what we see some dysfunction right at the top of his neck, and then right at the bottom of his spine, where things are a little bit more lit up there. So what's interesting is that these areas, if we stimulate these areas with an adjustment, that's going to stimulate the part of our nervous system that can calm us down. So this kid is really hyperactive, and go figure, the dysfunction that's showing up is right in the area that his body has been trying to calm him down, trying to calm him down, trying to calm him down. It can't figure it out, so it gets a little bit worn out. It's like a circuit breaker. So on this side, this shows the same information, just a little bit of a different way. So when a nurse takes your temperature, she's looking for one solid 98.6 degrees. We're looking at the range in temperature. So if there's a wide range, then they're having a harder time adapting to life stresses, the physical, chemical, emotional things. If the range is small, then they're adapting pretty well. So we like to see it within 2 or 3 degrees of each other from the top to the bottom of the spine. And what we see for him is 6.8. So for a boy who's 6 years old, that is more. That's go ahead.
Yeah, because that means at some point he might be 98.6 degrees, but at another point there's 103 degrees or 94 degrees. So that's a really huge range, especially for a little person.
Yeah.
Who isn't even on any medicine. That's because medicine can alter the range of temperature itself. So,
Yeah, yeah. So then the other scan that we do, this is called a surface EMG. So this scan, I say that this is kind of more like function. We're measuring the nerves and what they're going to, and if there's some kind of dysfunction there. This scan, I say, is more like feeling. So this is the surface EMG, and this is measuring electrical activity in our muscles, what we would feel as muscle tension. So the way that you read this, the white stuff is within normal limits. There's very little of that. The green, that's mild. The blue is more moderate. The red, more severe. And the black, that's kind of like severe plus. So this little boy has so much tension in his spine, and the reason, it could be one of the reasons it makes it hard for him to just sit in class and not hit kids, because his little body is so tense, so tense, so tense, he doesn't know how to relieve it or what to do with it. And then this second part of the scan, this takes all of these bars and averages them. So we could see, okay, yeah, his lower back, one side is working 145% more than the other side. But then it swaps over. His shoulders, one side's working 135% more than the other side. So I'll pass this around and you guys can kind of look at it. I forgot to bring a normal. Yeah.
one thing I just want to mention is when she's talking about this, in this little boy, he complains of no pain whatsoever. This, as an adult, would be somebody in incredible pain. But when we're little, we don't have that same level of inflammation to feel this. So how we see this going on are changes in behavior or changes in health. With children, you don't see pain. They don't talk about being in pain. They don't tell their mom their back hurts. At least that's the very small majority of the kids we see. The kids we see, it's more about behavior, or their parents just have learned because they come and they've learned what some of the signs are that their child should be getting adjusted. So as we pass this around, this child never once said, "I hurt."
So if a child does start complaining about aches and pains, that means it's really like a lot of inflammation.
Inflammation.
Yeah.
But it might not, they would not know that, at least, usually, they don't start feeling pain because the foods we eat, the garbage hasn't piled up enough until we're a good 12, 15, 20 years, then you start hearing about some kind of imbalance hurting.
Okay, so if a child is already starting to complain about back pain or
yes,
foot
then
pain, then something
there's
really
an
is off.
yeah.
Yeah.
So our autistic children, we get less of these scans because a lot of times they start at 4 or 3 years old where we can't keep them still enough. And that was just the last child who came in with a mild, it was a more mild diagnosis. But yes, the answer is they're already having more inflammation early. Gut health that isn't healthy leads to a lot of inflammation, but it takes years to accumulate where our brain perceives it as that. A lot of times brains perceive it as being tickled. So at first, there's this relationship rapport thing that has to happen because a lot of parents will say to me with autistic children, there's no way he's gonna sit still, or there's no way she's gonna sit still. And it's like, no, probably not on the first or second adjustment, but I will cooperatively just move around the room with them and work with them and be as patient as I need to be. We give a lot of time to just let it happen. And at first it is a tickle, but I find that right groove. She finds that right groove of what's the right pressure so that we can still do our job, but they can tolerate it. But over time they come to appreciate it. And the interesting thing I see with the kids that can communicate, whether they have autism or ADHD, or they don't have that, but they have a lot of other things going on, or maybe they don't, but their parents just know it's a good idea, is by the end of the adjustment and over time, the tickliness goes away. That jitteriness. So it's very fascinating to watch the process. Go ahead.
No, the only thing I was gonna add, and then they start saying, I need to go to Dr. Maria. I need, like they will tell you when it's time. Yeah.
Well, I think with some of our kids, we may not have any idea that there's any type of pain because they have such a high tolerance for pain.
Right.
So if they actually displayed pain, it would almost be critical, at that point.
Right.
And that's like our check-in. How I explain to other people too is that's like our check engine light. Like pain is kind of with the DIME study, like that function can be off for a long time before pain even shows up. And that's like our check engine light, like, whoa.
My adjustments, like how often would the patient have to go for adjustments?
It varies person to person. What have you found over the years that like whenever they first start coming versus whenever they feel?
It's interesting. When I first started, every couple of weeks we could still make profound changes. And I think our environment and the foods we eat have gotten even worse. So although that still happens, if the person's right down the street as opposed to them traveling 4 states away to see me, I will get them in there a couple of times, more like once a week, and then we move it to twice a week. And I've noticed
Once every other week.
once every other week, and then we just keep spreading it out. And we have some autistic children who don't come for a couple months at a time, or they live really far away. And now it's maybe a couple times a year that they come, but it still makes a huge difference. So it varies.
Yeah. So that's the majority of what I have for you guys tonight. I just wanted to give you an introduction, like what it is and what we have going on. Dr. Maria, she has some more stories of the patients that she's worked with over the years. So I'd like to hand it over to you, and then we can stick around if you guys have any questions afterwards, okay?
Thank you. That was really great. Thank you. I just thought, we talked about it and we thought it might be good. You haven't seen me. But when I was in high school, and I didn't even tell this part to you, but when I was in high school, I had the blessing of being the nanny for 3 children, and one of the children was autistic. And that's where my passion and my love for autistic kids started. And I've just been thinking over this talk, how he influenced me, and when I got into college, my focus became studying about autism, and I was fortunate enough to get an internship doing ABA, which might be old news here, but at the time, ABA was it. So I got to be when I was trained by people from Haddonfield, New Jersey, and at the time, they were the people on the East Coast to go to, and they were getting all their training from people in UCLA, and they were the place. They started it, and so I thought I'm going to get a fellowship to UCLA because I knew them directly, because I was getting trained with them, and I was going to get a PhD in psychology and do research, and this was my path, and that was that. And I personally had incredible neck pain since I've been 10, 11, and I was fortunate enough to have a mom that was open-minded and took me to a great chiropractor. I had so much tension though, I couldn't hold the adjustment. So the idea was great, everything that Dr. Beth said was great, he taught us all of that, and it just didn't work for me. And it was when I was about 19, 20, when I was already getting this externship, that my life had turned around. I mean, the anxiety, I used to have anxiety, I didn't have a name for it yet, because my mom had chronic anxiety and depression, and mine didn't look like hers. Mine was just a feeling of doom inside me all the time. I used to replay everything I said to people in my head, over and over and over and over. Could I have said anything to hurt them? Could I have, I never wanted to hurt anybody. Fast forward, I get these adjustments that are similar to ours now. My life is totally changed. And now I'm starting to look around, because not only is my life totally changed, because my neck pain has drastically reduced or is gone. I now no longer have that thing, I didn't even know to name it, anxiety at that time. My brother stopped getting ear infections, and he had ADHD that was starting to heal. So we didn't know if he was going to graduate from high school, and he ended up being first in his class at Lincoln Tech, and was, what is that called when everybody wants you? But he was headhunted by Porsche, by BMW, by all of these big names. They wanted him on their pit crews. They wanted him to come to their building to do what he did, because he ultimately became a mechanic. And now he does something totally different, and he can learn super fast. And my mom started healing from anxiety and depression. So anyway, now I start looking around at my autistic kids I'm working with and going, I can't change my profession unless this helps them. And so I don't know if you're familiar with the words discrete trials, but we had to do everything 100% and exactly. And we had to mark down how we did and how the child performed and if we got to move on to a new exercise, if we didn't. So that was really impressive for me because I talked the parents into going to the chiropractor who had helped me a lot. And within a couple of weeks' time of even the first couple of adjustments, the discrete trials changed and the improvement changed, and they needed to bring the people back from Haddonfield to get a new program because he was, the first one was just blasting through all of his goals. So I got to see the difference, which started making me hopeful, like, okay, if I change and I don't, aim for UCLA, I can be a chiropractor because this is what I'm thinking now. And when I got out of school, I made the decision I'm going to do this. But in the meantime, I became a TSS because still it's my passion. So I waited a year and I wanted to work with these kids directly. And now I had learned ABA, and at that time, nobody else had. So I felt bad for the other TSSs, and I felt bad for the kids who had the other TSSs because I had so much training. So I was able to see a nonverbal child between what I did and, again, talking his family into taking him to the chiropractor, and I did this with a few families. But I got to see him go from nonverbal and angry and hitting kids to talking in 1 year, and maybe his diagnosis was much lighter. We'll never know any of that. But it was just amazing to see the combination at the time. So I felt confident. I went to chiropractic school. So flash forward, I'm out, and I wanted to have many, many more kids that were autistic. And what happened, which was a blessing, was I got very busy. So busy that there wasn't any time or energy left to talk to families, so I just hoped that somehow they'd hear about it. And sometimes they did and sometimes they didn't. But I wasn't out talking. I made one talk to an autistic group like 10 years ago when I moved back from California. And so we've seen amazing things in our office with kids. And some of them are cognitive skill changes and very rapid ones. Some of them were slow and steady changes. We've always seen behavioral changes. That's always something we've seen. And whether they've changed their diet or not changed their diet, just having the adjustment has been really profound. And I wish I'd been out speaking more. And that's just not the turn my practice took. I just was a single person in practice doing everything I could to keep up with the practice I had. And so I just kept praying for more autistic kids to come, and they did, but I'd like more because we see so much difference. And now we have
diagnosis is increasing too.
Yeah, and we want to help. We really think what we have is very special. But it's crazy. Dentists have really educated the world about cavities and how they're important, and you can't see them, but you know now to take your child to the dentist so that when they're 40, they still have teeth. And chiropractors have not done as good of a job, and I'm one of them. So we have not gotten the word out that every child needs to be checked, not just autistic children, but every child. And we would love to just be able to just get the word out.
Even in school, do you remember when we were kids, they made you do like the scoliosis
Well, even if that happens,
they don't even do that anymore.
even if they do that, they don't say go to a chiropractor. And it's amazing how if you catch that early enough, it changes. And sometimes we're blessed that we see a 25-year-old woman come in with scoliosis, and she comes back to you a few weeks later, 3 inches taller, and saying, do you see anything different with me? And you're like, were you that tall the last time you came in? And she'll say, no, I'm taller now. But
My son has scoliosis too, and he's 6'6" with scoliosis. Wow. You really don't want to get
it doesn't always happen. The fact is the bones have grown a certain way, or they might have been born a certain way. But we can at least help that spine have the least amount of tension possible for their future health and wellness. So these are the things. We have a lot of little stories, and you can ask questions to both of us, but that's the stuff I wanted to say just because I wanted you to know this is where my heart was when I started practice. Now that we have a little more time, because it's not just me in practice, I just want the world to know our heart is here, and we just love everyone to try chiropractic, especially the kind that includes cranial. All is good, all is great, but I'm so glad that you've gone to a place that also works on the cranium.
But it
because
sounds